in this study, we included more than 2,300 first consecutive patients who came to the clinic, and they had a 1-hour appointment with us, like every of our patients. They also had to answer questionnaires about their quality of life, and most of them also had an objective test of their cognitive function. And what we found is that women, again, are 2/3 of this population, that they were also more frequently affected by neurologic manifestation of long COVID, including brain fog, headache, dizziness, numbness and tingling, and pain. They also had more frequent non-neurologic manifestation of long COVID, such as fatigue, alteration of heart rate and blood pressure, shortness of breath, and gastrointestinal issues. This study shows us that women are not only more frequently affected by neurologic manifestation of long COVID, but also more severely affected than men. So why is it the case? Long COVID is a new autoimmune disease affecting the nervous system in our patient population, and women are more frequently than men affected by autoimmune disease such as rheumatoid arthritis and multiple sclerosis. I think this is still a very big public health problem, which affects mainly people in their prime. So we see that the major population are young or middle-aged patients. 2/3 are women who are in their prime, and they are severely affected in their ability to work, which also causes some economic impact on the society. And people have moved on and have forgotten that there's still an ongoing epidemic of long COVID, which is oftentimes forgotten. And this is even more difficult for the patients, because when they have those symptoms, they go to see their medical providers, they look good on the outside, their blood work is okay, their CAT scan or MRI of the brain are fine, and they are often told that there's nothing wrong with them, and they are stressed, which adds insult to injury on those patients' obviously situation. And so we are happy to see those patients in our comprehensive COVID center at Northwestern Medicine, which has multiple subspecialties of medicine, including pulmonology, cardiology, neurology, and others, for the complete care of those patients' symptoms. We next want to figure out the underlying causes of long COVID, and we are currently carrying out a prospective study to identify and validate biological markers of disease activity, and hopefully this will allow us to better manage our patients in the future. We hope that our study will alert providers about the importance of a timely diagnosis of long COVID in women and targeted intervention, especially since women have been severely often affected by gender bias in medicine.